how long after implementation before you started seeing financial benefits?
Well, I think I may have mentioned this in a previous question, but I think we probably got to a break-even point, at least on the production side, within a few weeks, that we were seeing as many patients as we had been before, but we still had a lot of cost. You have the cost of two systems, a paper system and a paperless system, and you're paying for both of those costs. But in our clinic, it took about a year for us to be able to get rid of some of our medical records clerks, but then those people shifted over to entering clinical data. So we had more physician's assistants or RNs, LPNs, those type things. So it all balanced out in the end that after a year we were back to about the same number of FTEs per provider, so full-time equivalent employees with the ratio to the physician to those employees. So we got back to the same ratio we had before the implementation by a year. So at that point, our costs were fairly similar as far as what we paid employees, but you're still paying more for the electronic health record, and you still have some cost associated with your paper that you have to deal with, and that will gradually go away over time. And we, over a period of several years, we eventually totally eliminated the paper charts, and they're stored off-site somewhere. And I've not had to ask for a paper chart in 10 years probably. So at those times it greatly decreases the storage costs that you have. Your employee costs are about the same, but what I did see was that I see more patients than I ever saw before, and I'm getting home earlier, as I said, and that's a great benefit to us. I think the patients experience a benefit from that as well, that they have more time with us rather than us trying to look for records all the time. One of the most frustrating things that we had with paper records were patients calling up and saying, well, what should I do with that prescription that you gave me? And I'm not even sure what it was because my dictation hasn't come back yet. And they took the prescription with them, and now we have all that captured on the electronic record. So that greatly speeds us up in being able to address the patient's needs, but it helps us be more efficient. Paper system is that we would order this lab on patients all day long, and we would never see any of it. And then at about 4:30 in the afternoon, the lab would come and dump all the results on our desk, and after seeing 20 or 25 patients, we would have to go back through all of those laboratory results. We'd have to call the patients. We would have to try to locate them. We couldn't locate them. They didn't leave their right phone number. They weren't answering the phone. And it might take us several days to even get that information to the patients where it could be used. And now, within about 45 minutes of the patient coming in and having their lab drawn, it's back in the chart. We can discuss it with the patients while they're there. It makes us much more efficient. The patients like it better that way. They get better care because it's at the point of care that you have the information that you need. And we take better care of the patients. We do it in a more efficient manner, and everybody wins in that situation. That's just one example of how electronic health records make you much more efficient than the paper system. One other issue with finances is that we began ours with no help from the government at all. There were no benefits paid to anybody for doing anything, so the meaningful use money is significant. But it does come with a lot of boxes you have to check off to make sure you do things correctly to get that meaningful use money. But the money is available, and if you go into it with the proper attitude, you can have access to that money, and it'll be tremendously helpful to your practice. So just make sure you do the things they tell you that you have to do, and you can do them. You have to have the proper attitude, a positive attitude that we will get this done. And if you do that, then you'll get the benefit of those funds as well, which will greatly improve your financial outlook in a shorter period of time than what we experience.
Have you seen improvements in the quality of care your patients receive due to EHR?
I think there's not any doubt about it. I know that when I first came into practice, even keeping up with the medication list was almost an impossibility. Now, let me say this about any system that we have is that garbage in, garbage out. If you don't keep up with your medication list in whatever system you have, then you're going to have problems managing the patient. But if you build your system so that somebody, either the nurse or doctor, updates that list every time they make changes in the list, then it will greatly improve your efficiency and it will greatly improve the care that the patients get. Just a few examples in the medication realm, you can go back and say, well, when was it that we started that patient, started that medication? Oh, I see, it was in 2007, but I see we stopped it in March of 2008. Well, I wonder why we stopped that. The patient has no idea, and you go back to March of 2008 and say, oh, it was because it made you have muscle pains. That's why we stopped that medication. And so it makes you much more, it improves the care of the patient because you're not going back and committing the same mistakes that you made before. Not necessarily mistakes, but placing them on medications which cause them difficulty because you don't remember, the patient doesn't remember what the problem was, and you don't either. And so it helps a great deal in that regard. Just having the information available is very helpful, as I mentioned in a previous question, having the lab work there. Our system has an interface with the hospital that we practice in primarily, and because of that, we have the discharge summaries, the histories and physicals, all the consults there, echocardiograms, some of the other cardiac scans and things like that are in our system, and they're readily available to us. We're not guessing about the results of those things. So those type of situations greatly improve the health care of the patient, and it makes us more efficient at the same time. Electronic health records are very helpful at being able to search for things that we could never search for, or it was very tedious to search for with paper charts. And now they do have search engines that are capable of pulling all your diabetic patients, or pulling all your diabetic patients who have not had an A1C in the last 6 months, or patients with hypercholesterolemia who have not had a lipid profile in a year. Looking at your congestive heart failure patients that are not on a beta blocker or an ACE inhibitor. Those type things are very easily searched on most of the systems, and they can train your staff to do more elaborate searches, which can be helpful. Registries, we have not yet at this time really used registries, but registries in the future may be something that'll greatly help us, and it is greatly helping a lot of practices practice better medicine, being able to keep up with all of the guidelines that we need to on a diabetic patient and track all those things in a meaningful way, and then being able to take that and show, say, a payer that we are actually practicing good medicine. So those are all things that help the patients, but it also helps your practice as well.
Is there any encouraging words or advice that you could offer providers beginning their journey of EHR adoption?
Well, again, the most important thing is having a positive attitude, and people need to be prepared for short-term pain but long-term gain, and you have to have a long outlook. If you're going to look at the short-term, electronic health records are not for you. You have to have a long-term outlook, and it's going to be a painful process for months, and in some cases it could extend over a year, or in some situations with the electronic health records you may have painful situations with that, but it takes a long time to realize the benefits of electronic health records. But the benefits are tremendous, and I was pulled somewhat kicking and screaming into the electronic health record environment, but I'm glad that I was. I'm glad that we started as early as we did and have 16 years of data available to us electronically, and it greatly benefits us, it greatly benefits our patients. One of the problems I see with electronic health records that I think is a serious problem is the use of templates. Now, I'm not opposed to templates, but the problem with templates is that we lose the narrative description. And in medicine, a narrative description is tremendously helpful. The templates are very useful at listing the past medical history, the past surgical history, the family history, social history, those type things. Even the review of systems, it can be somewhat helpful on. But the present illness, in my opinion, you need to have some type of narrative description there. For one thing, you don't really know what you were thinking when you saw the patient if you just click off a bunch of boxes. And so you need a description that you can look back to and say, 3 years ago you were really complaining about the same thing. What did we do for you then? And the narrative description is very important, and I think it's unfortunate that on a lot of these systems we're losing that. So I would encourage the providers to continue to place some type of narrative description, whether it's with voice recognition system or whether it's dictating that part of the record. I would encourage them to do that. And then the impression and plan. Giving a list of problems is helpful, but if it doesn't really say chest pain, I think that it may be costochondritis, but it very well could be angina, and I think we need to run these tests to make sure that it's not angina. By the way, it could be a pulmonary embolus, and I think that we are going to need to get a CAT scan to make sure the patient doesn't have a pulmonary embolus, and be able to narratively describe to yourself or to another provider that's looking at that record what you were thinking, rather than just giving a list of problems that you have. Then the plan also, rather than just listing what medicines you put, I frequently put reminders to myself that when I see this patient back, we need to do this, this, and this, and that's difficult to do on a templated document. So the templates can be very helpful, but I think that you ought to dictate or use voice recognition systems to fill in some of the weaknesses of those templated systems. Another encouragement for people that are going to electronic health records is just the immediate access to the information, and I can't overemphasize how important that is. And all of us have experienced problems trying to find the chart or trying to find a piece of information hidden in a paper chart. It's much easier to get that information in an electronic health record, and physicians will see that as they get used to the system. As an exhortation, I would say you have to keep a positive attitude, and if you go into it with a negative attitude, it's going to cause frustration to you. It'll cause frustration for your nurses and other staff. It'll cause frustrations for your patients. But if you go in with a positive attitude saying, I'm going to make this work, I'm going to figure out how to use this system to better serve my patients, then you'll be much happier, your patients will be much happier and better served, and your staff will enjoy the working environment a lot more. So it's critically important to keep that positive attitude as they go through the process of implementation of electronic health records.